Welcome to the Sick Lab. Today we're diving into a topic that affects millions globally, pneumonia. Understanding this condition is crucial for everyone. So let's explore what pneumonia is, how it occurs, its symptoms, risk factors, transmission, severity, treatment options, and prevention strategies. Pneumonia. What you need to know. Ever had a bad cold that just wouldn't go away? What if I told you it could be something much more serious, like pneumonia? This infection doesn't just make you feel sick. It can fill your lungs with fluid and make breathing a real struggle. Today, we're breaking down what pneumonia is, how it spreads, who's at risk, and most importantly, how to prevent it. Let's dive in. What is pneumonia? Pneumonia is an infection that inflames the air sacs in one or both lungs. These tiny air sacs, called alveoli, should be filled with air, but when infected, they fill with fluid or pus, making breathing difficult. The result? Coughing, fever, chills, and shortness of breath. What causes pneumonia? Pneumonia can come from different types of germs, and the way it infects you depends on the culprit. Bacteria, the most common one. Streptococcus pneumoniae. Viruses, the same ones that cause the flu, RSV, or even COVID-19. Fungi, found in soil and air, affecting people with weak immune systems. These germs are everywhere. But don't panic. Your immune system usually fights them off. The problem starts when your defenses are down, allowing these germs to invade your lungs. Recognizing the symptoms. How do you know if it's pneumonia and not just a bad cold? Look out for these warning signs. Cough can be dry or bring up thick mucus. Fever and chills. You'll likely feel hot one moment and freezing the next. Shortness of breath. Even walking a few steps can feel exhausting. Sharp chest pain, especially when breathing deeply or coughing. Extreme fatigue, nausea, or diarrhea, more common in viral pneumonia. If you, or someone you know, has these symptoms and they're getting worse, it's time to see a doctor. How does pneumonia spread? This infection doesn't just come out of nowhere. It spreads fast. Through the air. When an infected person coughs or sneezes, the germs travel in tiny droplets. Through the blood. Some infections spread to the lungs through the bloodstream. Touching contaminated surfaces, then touching your face without washing your hands. That's why proper hygiene and avoiding sick people is key. Who is most at risk? While anyone can get pneumonia, some people are more vulnerable than others. Babies and young kids. Their immune systems are still developing. Older adults, 65 plus, the immune system weakens with age. People with chronic conditions like asthma, diabetes, or heart disease. Smokers. Smoking damages lung tissue, making infections worse. Immunocompromised individuals. Those undergoing chemotherapy or living with HIV or AIDS. If you fall into any of these groups, extra caution is needed. How serious is pneumonia? Pneumonia isn't just a bad cough. It's a global health threat. 450 million people get pneumonia every year. 4 million people die from it annually. It's the #1 cause of death in children under 5 in many developing countries. The elderly have the highest mortality rates, especially with other health conditions. The good news? With early treatment, most people recover fully. Diagnosis and treatment. Doctors don't just guess if it's pneumonia. They confirm it with tests. Diagnosis includes listening to your lungs for crackling sounds, chest x-rays to spot lung inflammation, blood tests to find the exact cause. Treatment depends on the type of pneumonia. Bacterial pneumonia. Antibiotics are the go-to treatment. Early treatment equals faster recovery. Viral pneumonia. No antibiotics. Rest, hydration, and antiviral meds in some cases. Fungal pneumonia. Antifungal medication is required, especially for high-risk patients. Sometimes, severe cases require oxygen therapy or hospitalization. So never ignore worsening symptoms. How to prevent pneumonia? Want to avoid pneumonia? Here's how you can protect yourself and your loved ones. Get vaccinated. PCV13 and PPSV23 vaccines reduce your risk. Practice good hygiene. Wash your hands and cover coughs/sneezes. Quit smoking and limit alcohol. Both weaken lung defenses. Live healthy. Eat well, stay active, and sleep enough. Manage chronic conditions. Keep diabetes, asthma, and heart disease under control. Taking these precautions lowers your risk significantly. Pneumonia is serious, but preventable. With the right knowledge, early detection, and good habits, you can protect yourself and those around you. Did you find this video helpful? Hit the like button, share it with others, and subscribe for more medical insights. Got questions? Drop them in the comments. Stay safe, stay informed, and see you in the next video.